This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945. Hey everyone, thanks for joining us on the Outcomes Rocket. Today I have the privilege of hosting Dugan Winkie. He is the head of commercial strategy at Cedar, leading go-to-market for new product innovation and strategic planning for the company. He spent the past 15 years in healthcare focused on provider growth strategy, operations, digital analytics, transformations. Prior to that, he did work with McKinsey and Company, and just an incredible background. So Dugan, so grateful that you joined us.
Yeah, thank you for having me. I'm excited to be here.
Likewise. So look, to begin with, talk to us about what inspires your work in healthcare.
Yeah, I think the short answer is healthcare is all I've known. It gets under your skin a little bit just because the opportunity for innovation is so vast, right? But, elusive at the same time. So I think my journey into healthcare started as, a young 22-year-old at Epic, getting screamed at by a radiologist because I added a few extra clicks to their workflow. But for me, it really helped me understand healthcare from a variety of different lenses, the power that technology really can have, but simultaneously the impact that it really can institute, operationally and clinically for that matter. From there, I really wanted to learn a bit more around, what keeps more senior leadership, C-suite up at night. So was able to really, flex into a variety of different roles at McKinsey, focused on the provider market, growth to cost to digital analytics. And ultimately, it is fairly personal for me. So I've been a partner riding shotgun with my wife, who's been navigating a chronic illness for about the past 15 years. So just being by her side is, she's had $10,000 surprise MRI bills and coordination of benefit denials, complex pre-authorization workflows. It really helps keep me grounded on the inefficiencies and frustrations that millions of Americans have to go through as it relates to the patient financial experience. And, Cedar is really, in my mind, a perfect fit to really help enact some of that innovation and change.
I love it. Yeah. And I'm sorry to hear that what you're going through. And yeah, to your point, it's so common and shouldn't be the case when it's so easy to get anything else done.
You can go to the car mechanic and get an accurate estimate and not be surprised at the end of the day, right? If that's the golden path at the end of the day, we've got a lot of work.
Yeah, seriously. So let's dive into Cedar. What does the company do to add value to the healthcare ecosystem? You mentioned finance. So talk to us about that.
Yeah, so our North Star is really the patient financial experience. So what that means is we are interacting directly with the patient for all things billing. And that could be an array of different solutions. It could be as simple as you have a bill, you need to pay that bill, and you leverage our platform to do so. But increasingly, it's not that simple. At the end of the day, there's affordability concerns, there's friction, and there's an array of different stakeholders that the average healthcare consumer really needs to navigate independently. So you call the health system, they say, I have this EOB that says one thing, a hospital bill that says another. The response is, okay, call your payer. So there's a lot of this ping-ponging between different parties right now that Cedar really wants to sit at the center of that ecosystem and help guide and be a bit of that financial Sherpa, right? That is helping not just reduce friction, answer questions, but ultimately help address some of the affordability concerns through more flexible payment options and, enrollment/coverage. So this all, I would say started 7 years ago with our flagship product, Cedar Pay, which at that time, the friction was so overwhelming. You needed to go to the doctor to get an activation code for your EHR, to start, a digital payment option, period. There was no Apple Pay, Google Pay. And, I think we have grown and innovated, right, as the market has continued to grow and adopt technology, which is a bit of what I'm looking forward to talking with you about, some of our more recent innovations.
That's great. Yeah. And remind me, Dugan, who are your customers? Like, who do you serve? Providers, payers, employers, the patients?
Yeah, I would think of us as, a B2B2C company. So our partners are generally providers. So it could be, large multi-state IDNs to, smaller, physician staffing agencies, but generally like kind of firmly in the large enterprise market. But really like what differentiates our product is our ability to interact with consumers. We are a consumer-driven company that believes that what you receive, about your billing experience, how you receive it, and like when you receive it should really all be personalized based on, your unique archetype. But, at the end of the day, we will be white labeled, into a provider's digital ecosystem to really be driving all of those interactions.
Very cool. Very cool. So then I guess, you see, this is a huge pain point. There's players on the RCM side, doing things on collections. You guys are more focused on that experience, right? So help us understand what makes you guys different.
Yeah. So I would say the goal with Cedar has always been to create a transparent, personalized, and empathetic billing experience. And that is not the reality out there, with status quo. If you know anything about revenue cycle management, there is a lot of regulation restrictions, even the idea of like 120-day dunning cycle, right? You have 120 days to interact with the patient before they get sent to collections. Historically, that has been, day 30, you get a statement, 60, you get a statement, 90 days, you get a statement. So we have really tried to disrupt, a lot of that, call it legacy architecture. And many times, like, there's no reason that your dunning cycle needs to be 120 days, right? Like, if you have a patient who has a $50 bill and a patient that has a $5,000 bill, those are two very different patients that are thinking about this in a very different manner, right? So if we can say, actually, give us 180 days to interact with this patient, or, that $50 payment should not be allowed to have a 2 to 3 year payment plan. But, this patient with the $5,000 bill, like, absolutely. Because a lot of, I would say, some of the misconceptions in the industry is that patients don't want to pay their bill. And what we find is that that's not actually true for the majority of individuals. Like, there are real affordability concerns that we need to look at, more holistically. I would say, like, maybe to close it out, like, the last thing that we're really focused on as it relates to differentiation is integrating, generative AI into our platform, right? And that could be through an AI bill summary when you are logging in. It could be, this financial Sherpa that is guiding you through whether you should apply for Medicaid, whether you should sign up for an ACA marketplace. But like, ultimately, like, where we are starting is as a AI voice agent that can be this initial layer of triage when you call into a provider. So, ultimately, like, we want to help answer patients' questions and resolve, some of those concerns, autonomously, and delegating or escalating to a live customer representative, for those, higher complexity needs.
That's cool. Yeah. And there's been a lot of talk around agentic AI and, the use of AI and agents to really improve this experience. What's your take on it? Is there huge promises? Is it a bubble?
Yeah, I mean, probably a little bit of both, or, a smattering. So first off, I think for us, here's how we think about, our AI agent. Like, it's going to be having an LLM driven, voice agent is going to be fairly commoditized relatively rapidly, right? But if you look at, like, the crux of what problem they're trying to seek or trying to solve, it's how do you effectively answer patients' questions and have an enjoyable experience. So what drives that? It's the data, right? It's not just a chat GPT wrapper where you can get basic definition. And I think that is what we view as like our competitive moat is we already have integrations with the providers. We can answer very detailed billing questions. We have integrations with payers. We can actually answer some of their payer-oriented questions. We have integrations with HSA banks where we can share their balance and actually process a payment, right? So like that's, I think, where the magic comes in my mind is like training our model so that, we can solve a much higher complexity use case than, a run-of-the-mill, all-encompassing, AI agent.
Totally. Yeah. I mean, I'll tell you, to date, my experience with AI agents hasn't been great. But, if the agents had the data, like you're telling me, that would be interesting. Like they would actually be helpful versus like this bot that you just want to get rid of. Like, so I think it's great that's key to have that integration of the data. Give me everything that I need so I could take care of this. So I'm not worried about it.
Yeah, an interesting like proof point to kind of make your case is we typically do an AI assessment for net new prospects or clients where we'll ingest their call recordings and then, categorize like what did they actually call in about? What did they say was their problem? What was actually their problem? Mm-hmm. And like what degree of automation potential like do we think? And like shockingly, like over the majority of calls are, I want an itemized statement. I don't understand what coinsurance is. I don't think my claim was processed properly. Like I'm confused. It's much more like education oriented than action oriented. And like we think at the end of the day, like if you can solve that education and have the answers for patients, like that's going to be your North Star, right? That wins at the end of the day.
With technology. Because you don't have enough people, right? Like there's not enough people out there to do this job. And we've all had questions about a medical bill we've received. Mm-hmm. If anybody hasn't, I want to meet them.
I have questions. I like live and breathe this world, and
we're in the business, right? Yeah. So I love it. This is great, very practical, useful. A lot of people are in need of this. As you've been building this, Dugan, like it's not easy to build new businesses. Tell us about a setback you've had and what you learned from it.
Yeah, I might start with why we decided on this use case in the first place. And it was really fascinating because Cedar is a technology company, right? Like we have always been a SaaS, technology company. But what we found is a lot of providers, were coming to us and saying, hey, we've got this operational problem in our call center. Like we are looking for a partner to help us. And, for us, like that kind of begged the question, like, what is status quo, right? Like, why is this so challenging? And we dug into a lot of these, outsourced BPO, early out vendors and found that consumers or providers have been starved for innovation, right? For 20 plus years. Like that business model has not changed. The biggest innovation was going from onshore to offshore, right? Like the telephony systems are all like fairly standard, but nobody really looked at like, how can we disrupt this entirely, right? And for us, I think it all comes down to economic incentives, where our objective is to automate as many calls as we can and have a delightful consumer experience, right? That's a win for the provider. That's a win for us as a technology company. A lot of the status quo vendors, a win for them is like, increasing over time the number of agents, right? That they are selling providers to satisfy their needs. So, that is kind of the fundamental problem that started us down this pathway where we can help, providers have a clear cost reduction and operational efficiency lever. But once we started building it, I think we had a really big like build versus buy inflection point. Do we want to partner? There's a lot of, AI voice agent point solutions out there, or do we want to build it? And I think we decided to take a more conscious build-based approach, going back to those data elements that we talked about prior. but like that was a big one that we hit that on a fairly regular basis of, how are we going to do this? And are we willing to sacrifice a little bit of time to market to ensure that we are building for sustainability over the long run?
Yeah, no, for sure. Those are tough decisions to make, but once you put that anchor in the ground, you stay with it. And I think you guys made the right choice. So kudos there. I love what you guys are doing, Dugan. I definitely am on your side here, and our entire audience is on your side because we need it. So for everyone listening, providers, payers, patients, employers, right? What closing thought would you give them? And maybe it's just for the providers, right? But your call, I'll leave that to you. Yeah. What closing thought would you leave them with? And then where can they find out more?
Yeah, I think the closing thought I would leave with is, there are vendors and there are partners out there, right? And I think the majority of health systems are trying to stitch together an ecosystem of point solution vendors, right? I have my Medicaid vendor, I've got my statement vendor, I've got our goal is to really be a comprehensive platform with the North Star of patient financial experience that can provide a truly integrated experience, for your patients. And at the end of the day, why does it matter? We're going to help boost, your overall ability to, collect from patients. We're going to help, ultimately drive efficiencies and cost reduction, through harnessing generative, and we're going to unlock additional sources of reimbursement and coverage for patients, right? So that's the trifecta, but you need to do it in a way that's really integrated and seamless for the patient.
I love it. Great summary and a very clear mission there. Where can people find out more?
You can absolutely find out more by reaching out to me directly and also Cedar.com.
Outstanding, Dugan. Thank you for that. And for everybody listening and watching, make sure you check out the show notes. We'll leave Dugan's LinkedIn profile there, as well as the Cedar website, so you guys can get in touch. Now's the time to make a difference in this space. Explore what difference these types of technologies and thoughtful approach like Dugan's and Cedar's is making for all of us. So appreciate y'all tuning in. And Dugan, thanks for being with us.
Thank you, Saul.
This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945.